Good day everyone, my name is Eric Sharwin and today I'll be talking about aspergillosis and how it affects human. We will be discussing on what is aspergillosis, fungi aspergillosis, the basic structure of aspergillosis, the life cycle, mode of transmission, sign and symptoms, lab diagnosis, risk factor, treatment, prevention methods, and finally the conclusion. What is aspergillosis? Aspergillosis is an infection caused by Aspergillus, a common mold, a type of fungus that lives indoors and outdoors. Most people breathe in Aspergillus spores every day without getting sick. Certain chronic lung pulmonary conditions known as aspergilloma, such as emphysema, tuberculosis, or advanced sarcoidosis, can cause air spaces cavities to form in the lungs. When people with lung cavities are also infected with Aspergillus, fungus fiber may find their way into the cavities and grow into tangled mass, also known as fungus ball, known as aspergillomas. Besides that, we also have invasive aspergillosis. Is the most severe form of aspergillosis. It occurs when the infection spreads rapidly from the lungs to the brain, heart, kidneys, or skin. Invasive aspergillosis occurs only in people whose immune system are weakened as a result of cancer chemotherapy, bone marrow transplantation, or a disease of the immune system. Untreated, this form of aspergillosis may be fatal. So basically now we're going to talk about the famous fungi Aspergillus. Okay, Aspergillus basically was discovered by this amazing Italian priest and biologist Antonio Micheli in 1729. So while he was actually observing the structure of the fungi under a microscope, the shape of the Aspergillium resembles and reminded him of the holy water sprinkler, and he named the genus accordingly. Some modern taxonomists even claim that it resembles to a toilet bowl brush. Aspergillus is a genus name that represents over 250 fungal species of largely saprophytic filamentous fungi belonging to phylum Ascomycota, which some cause fungal allergy or infections in. So besides that, you can find Aspergillus commonly in the soil. So when you are walking around in your shoes, you tend to step on soil and you tend to transfer Aspergillus fungi on your shoe. And basically, there are fungi with a saprophytic mode of nutrition where they obtain their nutrients from dead and decaying matter. They can be very pathogenic in humans where they cause severe allergic reaction and respiratory opportunistic fungal infection known as aspergillosis. So some of the common Aspergillus species are Aspergillus fumigatus, Aspergillus niger, Aspergillus flavus, Aspergillus nidulans, and Aspergillus clavans. Hi guys, so I'm Eric here. So basically I'm going to bring y'all a tour around my house to show y'all possible location of Aspergillus species. Jom. So guys, I'm going to start off with this shoe rack. So basically when you're traveling outside, you tend to use shoe and slipper, right? So there are possibility of transmission of Aspergillus species on the bottom of your slipper. Okay, next would be this filter from the air conditioning unit. As you can see that this might be a colony of Aspergillus species, and besides that, this is my outdoor fan. As you can see, there are a lot of dust there. Okay, next, when you're entering your house, the doorknob. Okay, so when you're touching the doorknob, possible transmission of Aspergillus species. Next would be the air conditioning unit. Okay, and any of your decorations. This is my standing fan. You can see the dust there. Possible transmission of Aspergillus species. Next, electrical appliances such as the refrigerator. Usually you can see them at the back, usually towards the cooling unit. Next, possibility under the sink. Finally, the washing machine. So usually you can find them all at the back of the cooling unit. So now we're going to discuss on the basic structure of the aspergillus. So basically there's a vesicle in the shape of a circle with filamentous expansion growing out from it. The hyphae of the aspergillus has two functions. So the vegetative hyphae, it helps to provide nutrient absorption. The reproduction hyphae, it helps for the production of fungal spores. Besides that, aspergillus species obtain nutrients from a... How does a aspergillus species life cycle goes? So basically, the wind carries the spores released in the air. So once the spore has actually landed in a favorable environment, they start to germinate. So upon germination, food cells will be produced because they need nutrients to grow. Once they have obtained nutrients, there will be a development of conidiophore. So once the conidiophore matures, it promotes the development of stractimata. Branching and elongation of hyphae occur more often, creating a mass of mycelium. So the hyphae develop into vegetative in order for nutrient absorption and reproductive to produce spores. Once again, the spore detaches and the wind carries it for the next cycle. So this diagram also shows the life cycle of Aspergillus as I spoke on the previous slide. So now we're going to talk about mode of transmission. Aspergillus fungi, they're transmitted by the inhalation of fungal spore, also known as conidia. They are found ubiquitously in the environment and they are continuously inhaled by humans. When inhaled by persons with a weakened immunity of the respiratory tract, they can cause opportunistic infections. Hi guys, today I'm going to tell you all the signs and symptoms of aspergillosis. First symptom, chest pain. Second symptom, blurred vision. Third symptom, headache. Fourth symptom, sputum in blood while coughing. Diagnosing an aspergilloma or invasive aspergillosis can be very difficult because aspergillosis is common in all environments but difficult to distinguish from certain other molds under the microscope. The symptoms of aspergillosis are also similar to those of other lung conditions such as tuberculosis. Below are example of lab diagnosis, usually a doctor likely to use to pinpoint the cause of aspergillosis symptoms. Firstly, imaging test, followed by respiratory sputum test. Thirdly, tissue and blood test. Finally, biopsy. The next slides will actually explain in detail on each lab diagnosis. A chest X-ray or computerized tomography CT scan is a type of X-ray that produces more detailed images than conventional X-rays do. So basically they can usually reveal a fungal mass, aspergilloma, as well as characteristic signs of invasive aspergillosis and allergic bronchopulmonary aspergillosis. Next, we'll be talking about respiratory secretion sputum test. In this test, a sample of your sputum is stained with a dye and checked for the presence of aspergillus filaments. The specimen is then placed in a culture that encourages the mold to grow to help confirm the diagnosis. Now we're going to talk about tissue and blood tests. Skin testing as well as sputum and blood tests may be helpful in confirming allergic bronchopulmonary aspergillosis. For the skin test, a small amount of aspergillus antigen is injected into the skin of your forearm. If your blood has antibodies to the mold, you will develop a heart rate bump at the injection site. Blood tests look for high levels of certain antibodies indicating an allergic response. Finally, we're going to talk about biopsy, where in some cases, examining a sample of tissue from your lungs or sinuses under a microscope may be necessary to confirm a diagnosis of invasive aspergillosis. So basically, by staining the sample with lactophenol cotton blue or by doing a direct wet mound with potassium hydroxide. You can see at the picture, the colony has turned into the color blue. Your risk of developing aspergillosis depends on your overall health and the extent of your exposure to mold. In general, below are the factors that make an individual vulnerable to infection. Firstly, we are going to talk about weakened immune system. People taking immune suppressing drugs after undergoing transplant surgery, especially bone marrow or stem cell transplants, or people who have certain cancers of the blood are the highest risk of invasive aspergillosis. People in the later stages of AIDS also may be at increased risk. Next, low white blood cell level. People who have had chemotherapy, an organ transplant, or leukemia have lower white cell levels, making them more susceptible to invasive aspergillosis. Third, people who have air spaces cavities in their lungs are at higher risk of developing aspergillomas. Fourth, people with asthma and cystic fibrosis, especially those whose lung problems are long-standing or hard to control, are more likely to have an allergic response to Aspergillus mold. Finally, we're going to talk about long-term corticosteroid therapy. Long-term use of corticosteroid may increase the risk of opportunistic infection depending on the underlying disease being treated and what other drugs are being used. Once diagnosis had been completed and the patient had been confirmed having aspergillosis, then the treatment should be such as below. Number one, observation, where simple single aspergillomas often don't need treatment and medications aren't usually effective in treating these fungal masses. Instead, aspergillomas that don't cause symptoms may simply be closely monitored by chest X-ray. If the condition progresses, then antifungal medications may be recommended. By using oral corticosteroids, the goal in treating allergic bronchopulmonary aspergillosis is to prevent existing asthma or cystic fibrosis from worsening. Antifungal medication by themselves aren't helpful for allergic bronchopulmonary aspergillosis, but they may be combined with corticosteroids to reduce the dose of steroids and improve lung function. Antifungal medication are the standard treatment for invasive pulmonary aspergillosis. The most effective treatment is a newer antifungal drug called voriconazole. Besides that, amphotericin B is another option. Please note that all antifungal drugs can have serious side effects including kidney and liver damage. Next, we're going to talk about surgery because most of the times antifungal medication don't penetrate an aspergilloma very well. Surgery is required to remove the fungal mass is the first choice treatment when an aspergilloma causes bleeding in the lungs. Finally, we're going to talk about embolization, where this procedure stops lung bleeding caused by an aspergilloma. A radiologist injects a material through a catheter that has been guided into an artery feeding lung cavity where an aspergilloma is causing blood loss. The injected material hardens, blocking the blood supply to the area and stopping the bleeding.
Aspergillus species have a wide geographical distribution and are often found in decaying organic matter. Conidia are released into the environment and then are inhaled deep into the lung air spaces. In one of the classic forms of this disease, invasive pulmonary aspergillosis, the conidia are inhaled into the alveolar air spaces, where the conidia germinate and become hyphae with invasion into pulmonary vessels. At this early stage, plain radiographs may not be revealing, but CT scan of the chest shows nodular lung lesions surrounded by a halo of low attenuation, reflecting hemorrhage around the fungal cell mass. Eventually, this lesion may cavitate with development of an air crescent sign, which is a favorable prognostic sign. Subsequently, with vascular invasion, the infection disseminates to liver, spleen, kidney, skin, and brain. This form of disease has an extremely high morbidity and mortality and requires aggressive surgical and medical therapy.
Now we'll be discussing on the spectrum of Aspergillus disease. So when a normal person who inhales Aspergillus fungus, they would not actually contract aspergilloma, but there would be possible colonization. An individual who have already had cavitary lung disease upon contact with Aspergillus fungi, possible chances of getting aspergilloma. Another individual who had chronic lung disease or who had undergone any lung transplantation, recurrent low respiratory tract infection, or sarcoidosis, they have higher chances of contracting chronic pulmonary aspergillus. You guys must understand that the fungi aspergillosis is a opportunistic fungi. Besides that, immunocompromised host or any of the following COPD or liver cirrhosis, prolonged steroids treatment, influenza H1N1 or prolonged ICU admission can directly lead an individual to get invasive pulmonary aspergillosis. And finally, any of the following, for an example, asthma, cystic fibrosis, or if the blood count of eosinophil is more than 500 cells, that individual is probably infected with allergic bronchopulmonary aspergillosis. How can I prevent aspergillosis? As you all know that it's difficult to avoid breathing in aspergillus spores because the fungus is very common in the environment. For people who have weakened immune system, there may be some ways to lower the chances of developing a severe aspergillus infection. First, clean regularly, install an air purifier, eliminate contaminated food, disinfection of water. So every individual should learn how to protect themselves from the environment. For an example, try to avoid areas with a lot of dust like construction or excavation site. If you can't avoid these areas, wear an N95 respirator is a type of mask while you are there. Avoid activities that involve close contact to soil or dust such as yard work or gardening. If this isn't possible, wear shoes, long pants and a long sleeve shirt when doing outdoor activities such as gardening, yard work or visiting wooded areas. Wear gloves when handling materials such as soil, moss or manure. To reduce the chances of developing a skin infection, clean skin injuries well with soap and water, especially if they have been exposed to soil or dust. Next, if you are at a high risk of developing invasive aspergillosis, for example, if you have undergone an organ transplant or stem cell transplant, your healthcare provider may prescribe antifungal medication to prevent aspergillosis. Next, testing for early infection. Some high-risk patients may benefit from blood tests to detect invasive aspergillosis. So the conclusion for today would be, invasive aspergillosis has a major impact on patient survival. So everybody should be safe and protect themselves because since this fungal is very common, any individual can contract them from the environment. So the only way to protect yourself is to be safe. Below are the references or articles that I have actually read and collected information on aspergillus and aspergillosis. I would like to thank every author of this article for such an amazing information. By reading all your articles, I'm able to actually prepare a wonderful slide presentation. Thank you very much. Thank you everyone for listening to my video presentation. Bye bye, take care, be safe, and please make sure that you wear a mask whenever you're leaving your home, sanitize and always wash your hand. Take care and stay safe.